Shalom. Welcome to the Excellent Woman Movement Show. This is your host, Pastor Patricia Wanyonyi. This is the place where I welcome you into your excellent world, where you dream it, claim it, and live it. You know, I'm so honored to be having this conversation today. It's one of a kind. We've been expecting it for so long. And you know why I am so excited is because I'm happy that this conversation is getting much more home than before, and that it is coming at the comfort of your home. So wherever you are, woman, I want you to understand that we are here for you. Our mission is Mission Woman. And today we are having one of the best gynecologists around. And more so, he is my personal gynecologist, and you'll be getting to know him shortly. But I want you to remember that this is our season of the cutting edge woman. And we are saying that the cutting edge woman is a woman that is highly specialized, highly advanced, highly updated. This is a woman that fits the needs of the society that she lives in. And we are saying one of the ways in which you can sharpen your edge as a woman is when you get to understand your reproductive health and how it is important in your assignment as a wife and a mother. And that's the reason as to why we are here. So I'm hoping that you will stay tuned. I want you to be ready. You will be sharing your comments on the comment section. Like, share, invite a sister, invite your mother, invite your auntie, invite your grandmother, great-grandmother. Call all your ancestry. They are needed here. And we believe that today we are having a paradigm shift, even in our understanding of reproductive health. So I'm here with Dr. Richard Mogeni. And Dr. Richard, I just want to, give you some time. You just look at that camera and maybe give us a brief introduction of who you are. Yes, welcome.
Thank you, Pastor Patricia. My name is Dr. Richard Mogeni. I'm an obstetrician gynecologist. I work in my teaching and referral hospital and privately practice at Fountain Healthcare. I'm a trained obstetrician gynecologist, meaning in simple terms, we deal with conditions that affect women. And obstetrics is women, pregnancy and the delivery and the care that is that. I'm also a trained fertility surgeon from the University of Valencia. We assist in assisted reproductive technology and the early development of the child. Assisted reproductive technology is what you might be aware, like IVF and other methods, like what we call intrauterine insemination for women who have one or other challenges together with their partner in terms of conceiving. At MTRH, I offer a leadership role. I'm the head of department in terms of obstetrics and the gynecology department. And at Fountain Healthcare, which is owned by a group of several doctors across the country, I happen to be the lead chair in terms of board membership. So I offer leadership at that level. When I'm not doing those things, I'm also the leader for the gynecologists in the region here. We call it North Rift. And I'm also a vice chair of the Kenya Medical Association, the doctors in this town, in Eldoret. Among many other leadership roles that I play, including my own church.
Wow.
Where I have a few roles also which I play. So I think it's a pleasure to be invited here this evening to have a chance to interact with you people. I have been following your programs and I believe that they are quite educative. And from social media, I've been, through liking what I see. I think you may have also picked that I'm your followers.
Yes.
So thank you very much for the invite. Here I am.
Wow. Wow. Welcome so much, Dr. Mogeni, and we are so excited and actually honored to have you. Yeah, because working as a medic, I actually know the kind of program and the kind of schedule you have, and so we are so honored to have you here. But you wear so many hats, and I think specifically, I still want to highlight, this role that you play as a gynecologist. And we are working in a generation that even some of them have no idea why they need a gynecologist, women. And it's more so a personal gynecologist, not just only, a gyna that you see when you need, but, somebody that follows up on you. And I just want you maybe to share with us, why is it important, especially because you're working with the cutting edge woman, right? Meaning that woman that is highly skilled, highly advanced, and fits the society needs. So why is it important for you woman to have a gynecologist? Yeah.
It's very important for a woman to have a gynecologist because, first of all, it's not, gynecology, it's one field that invades privacy. And once it invades privacy, you're not going to keep on sharing your private issues with every other person. Every day you come across somebody and you have to share that. When we interact with women, there are many issues. Some are very emotional issues which are disturbing them.
Yeah.
Some may have lost some pregnancies and they are really trying to recover from it. Some have got very, difficult issues, like they have issues to do with their sexual relationships.
Yeah.
And, they are disturbed. Some are undergoing gender-based violence at home. Others are disturbed about their self-image. And because of that, every small thing that they notice in their body, either they take it too seriously or less seriously. And, if you do not have your personal gynecologist, then your gynecologist will be your saloonist.
Yes, yeah, it's
your
referrals.
Gynecologist will be your grandparents. Your gynecologist will be your marketplace colleagues or friends, or rather your friends. And then you will be lost in what I call mythology. Everything you hear, you'll take it serious. And that has got serious implications on your health-seeking behavior. Because if you use rumors, then you will act as a rumor monger, and at the end of the day, that will have an impact on your life. Wow. So having a personal gynecologist is good because it will help align these things in your life. I need to add that many patients who see us nowadays, they have also found another gynecologist in Google and they die before they reach you. I think also having a personal gynecologist will help you so that they can interpret what you are reading in Google.
Wow.
Thank you.
Yeah, because doctor, I like to imagine gynecology like a car and your mechanic. You can imagine if your car is being handled by every other mechanic, and I feel like our bodies also need a systematic way of follow-up, even in terms of health, and that is why we are encouraging women, if possible, get a personal gynecologist, and that will help so much. All right, so we move ahead, and of course, we now understand that you work with the reproductive health of a woman, but I just want you to put us women in context. Like, what is reproductive health, by the way? What is reproductive health? Is it just because I have conceived and I am able to give birth, or because I'm receiving my menstrual cycle every month? So what is it really about reproductive health? Yeah.
So, in defining reproductive health, you must also define health. Health is happiness. I'm happy that the cutting woman age,
the cutting edge woman,
has realized that there are things you rather take seriously. And I say this because health is the well-being, physical, social, psychological, and most recently there has been a struggle to add spiritual component.
Yes. Yes.
So if you're not healthy in any of those aspects, then there is a problem. But the reproductive health, then it is the well-being of all those things in your reproductive health system.
Wow.
Which has got both the structural way in which it is, and also in the functional way, the way it works, the system it works. So if you have any problem, even psychological issues can affect your reproductive health system. So the reproductive health system, again, as it were, is a whole, structure of what defines a woman. And what defines a woman is the, in a nutshell, I'll call their biochemical things like hormones. There are structural things like the uterus, the tubes, the ovaries, the vagina itself, and the other surrounding organs which have got a role that they play in it. And then there is the physiological, there are responses to these various parts of the reproductive health, reproductive organs, how they respond to various stimuli. Stimuli here, I mean, if it is, if you going to, we are created. And I need to mention this because I also learned it not so long ago. For instance, animals have got a way that they relate to one another. Because, and again, their reproductive system is designed like that. Human beings are, interpreted to be near like those animals. But for some reason, they are the excellent type.
Yes, animals.
So they are the excellent type of animals who, are able to interpret what's going on with them, and then finally integrate it in their thought process. So there are quite a number of things which the reproductive health system defines in a human being. Not to forget to say that the whole body works in terms of systems.
Okay.
There's a respiratory system, there's a neurological system, right from the brain, how things are integrated. There's the cardiac system, your heart, and the way you breathe.
Okay.
There's, the way the blood circulates in the body. There is a way in which you eat food and they get digested. So the reproductive system ends with an opening. The opening is what we call the vagina. And this vagina, many people say is the source of many problems.
Very true.
Yeah, but I'm not sure because it's also, apart from being an organ for pleasure, can be a source of sadness for some people. Right from development. There are people who develop and they do not have this organ. And there are people who develop and for some reason, partly the organs develop. And they grow. They are like you and me, and they have very serious challenges in this life. And then the ultimate organ which defines a woman is what we call the ovary. The ovary is the organ behind your face. It's the organ behind your feeling, the feeling of a woman.
Okay.
That is the source organ. Why the hormones it produces are the ones which define the woman. And the big hormone is the estrogen hormone, which makes your face look womanish. And as our big organ is the testicles, which make us produce testosterone and androgens, which define a man.
Okay.
Just like the ovary produces estrogen, and the other hormones which define a woman. I have so much to speak, and as you are a Patricia, these things we studied them for like 3 years.
Yes.
I hope I've briefly answered
Yes, the preview.
Yeah. Reproductive.
So actually what I have highlighted from that is that reproductive health is the happiness of your reproductive system. You know? Yes. And it's determined by very many factors. And I think I had never seen that in that form. Yeah, but I want every woman to know that your reproductive health is also determined by your psychological health, emotional health. I hope not financial health. Okay, but also maybe financial health. Yeah, also. Yeah. All right. But now, because we've just begun to talk about it, and I want us to now break it down to now the real issues of women, concerning their reproductive health. And it seems to me as if every woman has a sort of a reproductive health issue. Somehow, a reproductive health, if it is menstrual, if it could be infertility, if it could be, it could be an inflammation, something that is not going right in the reproductive health. And I just want you maybe to tell us, Doc, today, what is up with us, in this time and age? Because we are battling stuff that our mothers and grandmothers never even had an idea about. Is it the food we take? Is it hormones? Is it, how we just handle ourselves? What's happening to us? Yes.
So, reproductive health, as I said, apart from the anatomical, aspect, there is the aspect of functionality. And functionality is a factor of the environment. It's a factor of culture. And even religion has an effect on it. And even the food we eat has got components in this. And, the interactions that we have with, and the environment here is quite a number of things. It could be, all of us are literally smokers. Because, there is a lot of carbon outside here because of the vehicles that we interact with. And that has a big impact. Our nutrition equally has a very big impact in terms of our hormonal environment and, in terms of fertility and other aspects in reproductive health. And our interactions have changed, We've lived several years as very obedient people to the culture and the society. But I think we have started being a bit disobedient. We are trying to see what else is there in this world other than where we were brought up, the manner in which we were brought up, and the way we are living. When I look at it, that has got implications. For instance, nowadays, really excellent women are going to school. And if they are going to school, they take a lot of time. A lot of time in school, you get to go all the way to your PhD and everything. And those things we used to be told in the village that you are of age to get married are no longer very relevant to a number of our populace. But you see, we forget one thing. And this is just an extension of the early question on reproductive health system. A woman, before you are born, you have got more than 7 million at around 20 weeks during a baby girl inside your womb. Around 20 weeks of pregnancy has over 7 million eggs. Immediately, that baby is born like this. Several of them will have died, up to like 3 million.
So you already have 2 million.
You already have, you've lost so much. And that might remain, for a while until the lady gets into puberty. So every menstruation is a loss in terms of the eggs in a woman. And that process continues because what happens in the process of life development, when you are growing, in fact, by puberty, we are beginning with like 300,000 eggs. So there are those losses. We call it atresia in terms of our terminology.
Okay.
And immediately after puberty, this continues. So every month, several eggs get recruited to be fertilized. And when it's only one which gets to the mark, the rest will die. And they keep on dying in hundreds of thousands and sometimes in tens of thousands. Until when you are of age 35, you basically talking of 10,000 of your eggs. By 40, you are talking of thousands. By 46, we are talking of hundreds. By 52, we are in menopause. We have literally ones, very few eggs. I'm not a man of bad intent. I'm not bringing bad news to anyone. But I think the modern woman also needs to look at this. Okay. In University of Valencia, where I underwent some training, those women, for some reason, they save their eggs. They know they are going to be in school, and healthcare is free in that country. So when they realize that marriage is not a priority, they go to the hospital, their eggs get harvested, and they get stored somewhere so that they can use them later. We are not yet in that in terms of technology. But I went through that roughly to define the life cycle of a woman. So a woman is actively in reproductive age, even beginning as early as 9 years. And that has got implications. Some in the modern world, young girls are even menstruating from as early as from 9 years. And this is because of diet and the environment where the kind of food we eat. But this keeps on. A woman is at the peak of fertility around 24 years.
Wow.
After 24 years, those between 24 and 35 years, everything looks nice. But after that 5 years, there's a bit of a struggle in terms of natural fertility. Things don't just happen as expected. And this is a common problem we are seeing. And I say this because of the early question you asked.
Yeah.
Why should you have your personal gynecologist? Your personal gynecologist might preempt these things to you when they are seeing you, so that you get prepared. Right now, as a fertility specialist, we are seeing women very late in their age 40s and even 45. They really feel like there's something that should be done to realize their fertility potential. But sometimes you wish that, this discussion could have happened. It becomes very expensive to pursue that at that later age than pursuing it a bit early. And I know this is, I'm touching many.
Yes.
Because of academics, even parents of nowadays are like, my daughter, masomo kwanza.
Yes.
So, but I think we should be conscious of that. The other thing is that because of our environment, where we live, what we interact with, it leads to different diseases. Okay. Apart from the sexually transmitted diseases, which were a common thing discussed, those years when we were in school. Nowadays, I think we no longer discuss that because it has become a part and parcel of us. Infections including HIV. But the common one which has got serious consequences on women is what we call chlamydia and gonorrhea, which destroys their tubes and therefore impairs their fertility.
Okay.
And we say chlamydia is a silent killer. So once infected, sometimes you don't realize some mild pains, which sometimes disappear. And in the end, when a young lady begins to explore her fertility, then they realize they cannot conceive. Then, we have got the cancers, which are a fact of environment, diet, and age. So everyone who's aging, as you age, there's a new problem that's coming. The unfortunate bit is that our reproductive organs are useful during what we call the reproductive age.
And I think that's where I want us to really highlight, because I feel like this conversation will really help women so much. Like you're basically telling us that the best season for reproductive health is 24 to 35. That's what you're telling us.
Yes.
This is the best. The best season. But now, because age will do a disservice to us, I want to know, is that technology of egg freezing available here in Eldoret?
Yes, we have the technology in.
You can shed more light on that.
We have it. I don't know whether still Medihill is functioning. They used to do that. And currently, I think Eldoret Hospital, there are many facilities coming up, like in Kisumu, Fertility Point. In Nairobi, there are several clinics which are trying to do that. So if you did that egg freezing, then you mean you have to part with some cost per year. If I remember, I'm not so clear, but we can check. It's like 70,000 per year for your egg to be frozen and be saved.
Okay.
Yeah. Yes.
And the process of extraction of the egg?
I'm sorry for distracting you in that kind of direction, but this is technologically not an easy debate. But the process of extracting is a voluntary process. It's you, your eggs, you present yourself to a fertility doctor, you discuss your issues as to why you want them saved. And then the process of harvesting requires a bit of anesthesia. So you sleep a bit. And then, using the technology in terms of ultrasound and some needle-guided kind of ultrasound, we are able to obtain eggs, but sometimes it follows, depending on your state, it follows some kind of medication to ensure that you have got a good harvest of eggs that can be harvested and be stored.
Okay. And I actually was reading and discovering that even we have a technology that can be able to tell us how many eggs that are left and how many follicles, are functioning and all that. We have it.
Yes, there's technology, but I think, we have what we call silent eggs. I think I'm trying to use lay terminology.
Yes.
These eggs only come to fruition when you are just about to menstruate, or if you've been artificially made to ovulate. We call that control ovarian stimulation, in which you're given some drugs which can enhance ovulation. And in the process, a number of eggs are produced. Then we are able to harvest those eggs. But those are, I'm not very sure whether we've reached that level of leisure kind of thing. Because at this point we are also struggling with many women who are unable to take in. And in MTRH, I run an infertility clinic twice a month, every second week. And the last Tuesday, every second Tuesday and the last Tuesday of every month. And I can tell you in one booking, we see like 17, 18 patients, and it's not easy. A number of these patients require a lot of time. You have to deal with the emotional aspect. And they come with this mind that, once I see the doctor, everything is going to be okay. And for some reason, the doctor becomes like a source of bad news and then gives a very long list of the things that needs to be done, including alternatives for their care. And I usually see we undergo very emotional moments after the clinic. A number of times we debrief our nurses. Sometimes when you see people going through difficulties, other people try to feel like, hey, that can equally happen to me or somebody close to me. But I can roughly say that I think we've not reached that level of leisure. There are many eggs stored. Because even those who have reached 38 years, for example, and above, they cannot use their own eggs for that technology.
Yes.
Because you need like 15 of them
And
to be used on you. And most of the times, the egg count has reduced. So what usually happens is that you look for a donor. Donor here for us means a young girl.
Oh.
Yeah. So some of you have got eggs that you need to donate. When you are, at the right age. But, people like those 24, 25, 30, they have plenty of eggs.
Wow.
That they can help other people so that we use that technology. I'm not sure we really explore this. This is science. It's a bit deep.
It's a bit deep, but that is our main issue. And I think why that has captured me so much is because this information is not available everywhere, right?
For sure.
Yeah, it's not available everywhere. Like by the time we are 35, that's when we realize, time is ticking. And by the time we want to act, it's already too late. And I think it's an African mindset. Let's-seeking behavior, let's-seeking behavior. We just want the last minute rush. But why my interest is there? It's because what we are talking about, even the cutting edge woman, one of the scriptures in the Word of God that you're standing on, the Bible says that knowledge and wisdom are the stability of our times. And every time I tell them my story of how I conceived, I keep telling them that even God can use a medical doctor, because still even science, has a backing from God.
Sure.
Yes. And that is why even in the context of church, we just want to awaken our women and tell them there are options. There is how you can have knowledge and work with it wisely towards transitions of your season, so that we avoid all this late minute rush. But something that I want to also highlight under that, because I remember when I came for my first visit, the first time I came for my visit, I think you ran some tests, and you were able to check my hormones, BMI, sugars, and the ovaries and all that. And I think you came up with a conclusion, and you were able to tell me this and this and this is not okay, this and this and this is okay. So I just want maybe you enlighten our audience and let them know what are some of the tests that they could be running even during this season. You may not be married, you may not even be looking to conceive, but just the consistent visit to your gynecologist. Like, what are you supposed to be checking in your reproductive health? Yes.
So we, as it were, there are routine things which are recommended for women at various ages. For a very young woman who is just experiencing her menses and she's in school, and her biggest problem is menses, I can only say this: painful menses are not normal. So painful menses could be an indicator to this condition which you guys have come to, that has come to your attention, called endometriosis.
Yes.
So such young women, they need, when we were in high school, I was in a mixed school, when a girl or a young girl has painful menses, they are treated by the matron.
Yes.
I don't know what they give them.
It's just painkiller.
Just painkillers and something they call Pascopan, which might not necessarily be the right medication for what they are going through. But when periods are very painful to the level that they are, interfering with your productivity, it means they require a bit more attention than the usual ordinary attention, matron.
Yes.
The reason being, this endometriosis is a condition where, for example, it's like you are menstruating backwards, whereas some is coming out, some bit of it is going back to the inner side of your abdomen.
Okay.
And because it's clots, it causes, healing, happens through collecting blood and then creating a cover, which we call fibrosis.
Yes.
And those fibrosis things are the source. When they are creating that cover, it causes a lot of pains.
Okay.
Yeah. And So that's why, to me, right from the beginning of the reproductive onset of a young woman, they should take their reproduction very seriously. So painful periods is not normal. I think that's what we can be preaching to your children also. You people have children at home, and sometimes they say, even me, I felt like that.
Yes.
So that should stop.
Actually, the thing is, we are told once we give birth to our first child, they go away.
Yes, there is a social component to it, and there is a medical component to it, because endometriosis is, every time you experience pain, you feel it will be very painful. When you are pregnant for 9 months, you are not experiencing pain.
Yes.
Okay, roughly I can say that not necessarily true, because we are not going to tell every girl who's experiencing painful periods to get pregnant. But if you are of reproductive age and you are married, and then you need to pursue that. So that endometriosis, as doctors, we are trained on how to spot it and what to do. When it's very severe and discovered very early, it's treated in many ways that can save you some headaches later in life, including infertility, because it can be a source of infertility. Yeah. And you've heard that endometriosis can be anywhere. It can be in the nose, it can be in the umbilicus, it can be in the lungs, it can be in the brain. Because you can bleed in the brain, and people are treating you as a neurosurgeon, but it could be a reproductive health thing. You can have, producing blood in your lungs. Your lungs are menstruating. Yeah. Or rather, your umbilicus is menstruating. Actually, or rather, you are.
I think we need to explain to them endometriosis is when part of the endometrial tissue, like your uterus tissue, is deposited in different
sites.
That's why it's
bleeding. And it can even be deposited on the ovary. It can be deposited on, the area between the uterus and the gut, and that one causes a lot of pain. Even sexual pain. Yeah. There are women who have a lot of pain during sex. Those ones also, they need to see us so that we get to find out why they are having that pain. It could be endometriosis. Okay. So as you move along the ladder of growth in terms of your reproductive age, when you come to the level of puberty and you've passed there and you are a teenager, the greatest danger for teenagers is, relationships with adventure. Yes. And therefore, adventure has its own consequences. Yes. I didn't know, but I have come to learn that, the exposure from our young generation to a number of things, they can do a lot of things. Okay. Yeah, I have consulted, where you get even young girls have gotten involved in group sex, in, all kinds of sexual adventures. And the good thing about this generation is that they get concerned immediately when they see something is wrong, especially about their sexual life. So they will come. And then, there is also unplanted and unwanted pregnancies, which will arise at that particular age of teenage. And the sexually transmitted infections, including HIV, that chlamydia I talked about, which can have later life consequences, gonorrhea, and other, mild kind of vaginal infections. And as they progress, they get to where they are now properly in reproductive age, they are married. And then other things also come about. Once you are married, your ecosystem is not, you are not alone. Yes. Your interactive environment is two people. Yeah, two people. Unfortunately, sometimes it can be more than it can be more than two people. Yes. And for that reason, there are also other consequences which come with that. But, women of reproductive age, pregnancy itself is a disease. Yeah, as much as pregnancy is a blessing, it can be a disease. Especially pregnancies in young age and old age. Yeah. It has got other issues like high blood pressure. which you guys might have learned that actually pressure in pregnancy can be fatal. It can kill.
Yes.
If you've not had a friend who has experienced that, then you have not interacted with your friends. They are quite a number.
Okay.
And then, you then realize that even the journey of pregnancy itself is very hectic. You get these women, for the first time, they are getting this nausea, vomiting, what we call hyperemesis. And it disturbs them. And the young generation that we have sometimes wonders, must you really suffer like this? I think it's time that, we encourage them that it's a season. It will come to an end. And you will get where you need to get. But also, during pregnancy, it's very important that people have their personal obstetricians or gynecologists, or at least, if you cannot afford, attend a clinic. The clinic usually begins as immediately you get pregnant.
Yes.
And I'll explain why. So if you've missed your periods today, 2 weeks later, you need to get to the doctor, at the very least. That's when the clinic begins. And it begins for this reason. Pregnancy is not, we have to determine as doctors that the pregnancy is viable, meaning it's a normal pregnancy. It's in the right place. It's not in the tubes. It's not in the tubes. Because if we find it is in the tubes within those 6 weeks, I call it, then we might have options and alternatives of treatment. If it is in the tube and you're coming like 9 weeks, 10 weeks, it means the surgeon must use a scalpel to treat your problem. So that's why the clinic has to begin once you've missed your periods. And there's also another good reason why the clinic begins that early. I'm trying to travel the trajectory of a woman throughout their reproductive life. By 12 weeks, we do all those tests to screen for any problem. So, women tell me, the young generation of our women will tell me when they are coming to my office that Niko na Paul. I never knew initially what that meant because I think I'm old. I have accepted that I'm not in that age. So what that translates to in reality is that they have started appreciating pregnancy. That's when they are coming to the clinic. That's very wrong. So clinic is supposed to begin, immediately you miss periods. At 12 weeks, we see you. We need to do all those tests. We need to screen for HIV. We need to be sure that your blood level is okay. Because if you are anemic, that pregnancy is going to have problems. Anemic, I mean if your blood level is low. If you have urinary tract infections, that's why we test urine. You might lose your pregnancy. Before. And we test urine to check whether there are even infections which do not have symptoms, what we call asymptomatic bacteria, meaning that we have to screen all these things. We need to know your blood group because your blood group is very important. People who have something negative and they are women, it's very rare that in life they'll meet a partner who's also negative. Almost 99% their partner will be positive. Blood group will be something positive. So those women, their care in pregnancy is not the same as those who are blood group positive. It's different. So we need, and the most problems begin around that time, from 12 weeks going forward. So then we also need to check your blood sugar. And she mentioned it. That these are very important things for us to check. Reasons being, if you are diabetic, in other words, if you have high levels of sugars in your blood, and you are pregnant, that baby is going to be malformed. Sugar is toxic to the baby. It makes the baby to grow very fast, and also it interferes with the development of the baby. By 20 weeks of pregnancy, you will find that there are already problems. And also the reason why we see these women early is also to make some decisions. When you are in our school, we teach that no woman should become pregnant without planning with their gynecologist. I know it sounds funny, but that's the truth. Why? Some of us have got heart conditions which are incompatible with pregnancy. You're not supposed to become pregnant if you have a certain heart condition.
Okay.
Or rather, if you had diabetes or you have sugars in your blood. You're not supposed to become pregnant before the doctor ascertains that your sugars were well controlled, like 3 months before you become pregnant. You are high, if you're having high blood pressure, you need to control that blood pressure before you become pregnant.
Yes.
Otherwise, we lose that pregnancy. But more important, there are drugs that people take for other conditions, including cancer and other things, which can form babies which are not compatible with this life. So you have to discuss with your obstetrician. And again, I repeat in a polite way that, a cutting, what did you call that? A cutting edge woman should be able to plan their pregnancy with their doctor before they become pregnant. But along pregnancy, there are also other issues which come around. Like, by 20 weeks, by mid-pregnancy, our natural expectation is that the baby is fully developed. Okay. So at that time, we do some ultrasound to see that the baby is fully developed. That's around 20 weeks. From 24 weeks to 28 weeks, we are checking some women from nowhere, sugar comes. Or even their blood, some things happen, what we call platelets, the things which help blood to clot. They go down. We call this gestational diabetes. Or rather, from that 20 weeks, some women, blood pressure just erupts. So you see throughout the whole pregnancy, there's no way you can dissociate yourself from the doctor. You have to engage the doctor. And then, we have to keep on following you until, we can even help determine and guide you which mode of delivery is likely. Mode of delivery is not your choice. Okay. It's not deliver normal. Yeah, that's okay. Normal delivery is always our wish. But now, the reason why we follow you, by around that 6 weeks, we can roughly predict the way you might deliver.
By 36 weeks?
Yeah, because we'll have known what's presenting down there, what's, how your pregnancy is going to go. We are even trying to see how your baby is growing. Some babies can grow very big, while the mother is determined to deliver normally. Yeah. And actually, a number of women pursue that normal delivery, which is okay. Even doctors will pursue normal delivery. But sometimes, I think for the excellent woman, I think yours is to have an open mind and listen to your doctor. Yes. Because that guidance is very important. It's not that every doctor, we have been associated with cutting and, taking women to theater. You are right because you do not have the knowledge we have. And we cannot condemn you for thinking. Like, every doctor wants to section a woman. But listen and ask questions freely to understand the rationale behind why the doctor is making that decision. It's true, at times the doctor can be wrong. But a number of times the patient, the natural way of training our patients, the excellent ones, is that when you are before a doctor, you are not the lesser person. Yes. You are, you have the authority to ask questions. Like, what are the risks of pursuing this pathway? And once you are explained the risks, you are also supposed to discuss what are the alternatives. Wow. What else can I do? Yeah, must I really have to undergo this? Yes, or there's another way. You need to be human and ask the questions in a natural way. So usually I tell my patients and, we discuss what are the risks, what are the alternatives, and what are the benefits. And you're so good at that, honestly. And I'm not sure. You put it out the way it is. You are very sincere. Yeah. So thank you for recognizing my sincerity. I hope it's recognized by every patient I interact with, because we do not have an option as doctors other than to be sincere. That's what we failed to do. So by the time we make that decision, by the time you make that decision as a patient, because it's not our work to make the decision, we guide you to make that decision. It has to be safe for you.
Yes.
And it has to be something that you've clearly understood. So my advice to the, to the cutting edge woman is that know that you have got freedom to interrogate your doctor. You can engage your doctor. Some doctors are very happy when patients engage them. There might be a few of us who might sound very busy. Sometimes it's circumstances, but every well-trained doctor, they want to give you the information that you need, and so that you make the decisions which are safe for you. Because also it's not 100% that what the doctor tells you, you'll get the result in that month. We can take you to theater and you die, for example. That's suffering for the doctor. But if we had an understanding that everything has a risk and everything has an alternative, and it's you who made the choice, it becomes easier for the doctor. Then when you get beyond reproduction, now we've delivered, you'll take care of the children. And once you began your 40 years, you say...
Wait. There is something I want us to talk about, because you brought it out, and that's why I'm just flowing with you now, because I think you can shed some more light. You mentioned about smoking. And I feel like in our generation, I see much more women who are exposed to alcohol and, smoking. And I would just want you to maybe tackle on that, because I feel it's an issue in our generation. And could that have like a bigger impact on our reproductive health? And then number two, also, when you are talking about sugars, and I think I want to relate it in terms of now weight management and its impact on our reproductive health, and as well as you highlight the PCOS, because I realize most of the women that I interact with are actually going through the PCOS, and they just don't know how to handle. And sometimes they imagine only big women have the PCOS. They don't know that it cuts across whether you're lean, whether you're overweight, and all that. So this alcohol, smoking, and then impact of weight on fertility, and then PCOS.
Thank you. When I was training as a young doctor those days, I used to get ashamed to ask a woman on their alcohol history and smoking. Until, I got exposed to internet and realized that there are more women currently drinking than men, from the way things look. Because I think for some reason, women have found a way of unwinding, which is not the same as men. Men are a bit stingy, and they do not see, if you get a drunkard, it's a proper drunkard. If you get another one who is thinking about their business, they are in another world. But a woman releases themselves, They can go to the clubs, they can go to, if you watch Churchill Live, I'm sorry to quote him, you'll see that 3/4 of the audience is not, it's women, isn't it?
That's right.
I don't know what happens there when he'll come to Eldoret and attend his show and get to understand. But let me talk about smoking. Smoking is deleterious in terms of health. That one is a fact. And that's why the government is struggling to punish smokers in many ways. So for the man who smokes, let's begin there. You've almost 90% chance that you've been fertile. A man who's smoking. Smoking clears the sperms. I think and that's a fact. 90% of those who converse to us that they are smokers, and we do what we call semen analysis, we'll find that they have very few sperm count. And even if they have the sperms have got abnormal heads, tails are, and even if they end up impregnating a woman, then they end up with serious risks for pregnancy losses because genetically the baby is not well formed. We call it oxidative oxygen stress. I mean, the smoke, when it goes to the body, it affects the life origin of our life is the cell. The cell has what we call DNA. That DNA gets fragmented by smokers. And the same thing we can have an effect on women. Especially, and that's why I say, even if you are staying with a smoker, you are equally smoking.
Yes.
And that also has those oxygen radicals, I mean poisons, let me use that word, which affects your reproduction. So smoking, for those who want to really engage in terms of reproduction, then they have no option. Here we do not have two ways. We cannot begin to behave like the Wazungu that how many cigars you smoke, how many buckets. There is no room because already we are smoking outside here. And literally you are adding to your body, you're causing a lot of problems.
Wow.
So there's a high risk of pregnancy losses with smoking. And alcohol, the same. So there's something we call alcohol fetal syndrome. Those guys who drink a lot of alcohol, they have malformed babies with very small heads, very small stature, and the children do not, catch up very fast in this life. So alcohol is a problem. Apart from just being environmental hazards, they have got effects in terms of sexual life. For instance, people who are addicted to smoking, we usually compare people in terms of, I don't know whether people are addicted to sex, but you see if somebody likes smoking, including my friends from the mountain, the eastern part of it, who chew, is it Mira, Muguka, and the rest. All those things have got effects, including this marijuana and the rest. Those guys just get stuck into those things. Sex is a secondary idea sometimes. And that affects families, and it affects the way they relate to one another. I'm sure somebody might throw stones to me, but you can forgive me for making that rough assumption. But any substance abuse can lead to very serious effects in terms of your sexual life, and even in the really components of what you are producing. And then, we come to PCOS, which I'm sorry I forgot to mention during the reproductive life. Polycystic ovarian syndrome is what is commonly known as hormonal imbalance in the population. When a woman tells you I have hormonal imbalance, some of us are able to integrate it to mean like it is another disease that they are unaware of. And I say this because, see, if you're missing your periods, every time you ovulate, if you ovulate today, 14 days later, you are likely to experience your menses.
Yes.
If you see a cycle which is going beyond 35 days, or rather a cycle coming below 21 days, that one needs attention. And the people who have frequent cycles, like, you're having a cycle below 21 days, you need to see the doctor, because also you are, like I mentioned earlier, it means that you are ovulating very quickly. And at the same time, you are losing more eggs. You might get into menopause a bit early than other women. So short cycles, they need attention from the doctor. Very long cycles, they equally need attention from the doctor. And this is where polycystic ovarian syndrome comes in, a condition in which you have an ovulation. An ovulation, we mean sometimes you do not ovulate. If you do not ovulate, your periods might not come. So you'll find somebody has 2-3 cycles in a whole year. A normal woman, which protects even your endometrium, your inner wall of the uterus, you need at least 9 cycles per year. When they are at 2, 3, there's a problem.
Okay.
9 protects you because you have to keep on shedding the endometrium, the inner wall, and regenerating a new one. When it stays for long like that, there's a risk later in life in terms of what we call endometrial cancer. So even women we see who have polycystic ovarian syndrome, we want as much as possible to find ways of them experiencing their menses so that they are at least 9 in a year. And so I've said one of the key components is an ovulation, where you are not ovulating. The other key component in it is signs of imbalance. The imbalance here is that every woman has a male hormone we call androgen. Every woman.
Okay.
But when there is a tipped balance, you can suffer hair loss, mild hair loss, which you might not pick. You know, you might realize your head is not you plaiting your hair and it's not getting plaited properly. You might, you know, we call it a sign of a man now.
Yeah.
You might also grow some very thin hair. We call it hirsutism.
Yeah.
You know, some people, you look at their skin and you see like their hair pores. But it's not necessary. You don't have to look at yourself.
And then the chin.
That's the problem of getting information when it's not complete. They might have 1 or 2 hairs here at the chin. Yeah, all that we call hirsutism, and it's graded. It can be very bad for some women. You know, they are having a hairy body like that of a man.
Yeah.
And it can be as mild as wale wanasema nywele ya kama ya mzungu. You get it. Yeah, and then you find they are, you know, instead of coming to us, they are going to, what do you guys call it, where you go to beauticians to remove the hair. What is it called?
Oh, yeah, the spa. For waxing.
I think waxing.
Yes.
Yes, you know. You know, the modern woman will tell you, I went for waxing, you know. But sometimes they are not oblivious that actually they're having a problem that needs a bit of attention. And then it can go as far as having some male kind of voice if the androgens increase a bit more. But the cardinal one is pimples, which every woman struggles with.
Yes.
When you are having acne, it might be a point that there might be something to do with your hormones that needs to be checked. But now the worst part of it is the metabolic bit. Yeah, polycystic ovarian syndrome can create what we call an impaired glucose tolerance in your body. Your body the sugars can have a problem. They might be a bit higher than normal. And I'm saying all these things because they are not uniform across the board. The typical case of polycystic ovarian syndrome, the weight is the disease. It's not them. You know, you might be seeing someone has very big weight and you're wondering what it is. But it's a disease that they have to be working on. You know, even when we tell them reduce weight, we usually don't tell them to reduce the weight as such. We tell them just work hard and shed 5%. Because that goal, they do not have control over it. But currently we have got polycystic ovarian syndrome is also a factor of nutrients. Like, you know, omega-3, vitamin D, and several micronutrients, which can be a problem. So actually, among the first treatments we are using nowadays is supplementation. Because
actually people are busy, they don't have time to cook. You know, you have, what are they called, what we do in PhD, thesis, you know, to work on. So people just take snacks, and it is affecting our health.
You're right. So all those things, we look at them, and besides trying to balance the hormones now, so you guys call it the hormonal imbalance. Now as doctors, we have a method of trying to balance. But the worst bit of polycystic ovarian syndrome is that if you cannot ovulate every month, you are unable to predict when you are ovulating, and therefore becoming pregnant is a big issue.
Yes, yes.
So those women sometimes have to undergo what we call ovulation induction for them to become pregnant. And it's possible. It works for some. For some, it requires a bit of patience because there are many issues. And then I come to weight. Weight, both for the man and for the woman, have got an impact in terms of fertility and the reproduction and the outcomes. Fertility, let me begin with the man because that's where I am. It's not, the modern man also, the modern woman likes this man who has a capote, those kind of things, but I want to say that every time there is what we call trunk obesity, it affects even sexual performance.
Okay.
And even men. In fact, one of the ways of sorting out low libido in terms of sex is exercise.
Okay.
And exercise works, so long as metabolically you are doing something, it can really be helpful in terms of exercise. And it has been noticed that if you have a higher weight, it can lead to undesired outcomes, even in terms of pregnancy, even in terms of your sexual, engagement. So usually, from medical point of view, we advocate because weight loss is work in progress. It's not something that's achieved once. So we set very mild targets that are achievable, like that 5% that you've mentioned, and it works. So it doesn't always mean that, if you have a very high weight, you cannot undergo some things. You can. But we always advise that you work towards reducing that weight, mildly. And we have seen very good results. Like for polycystic ovarian syndrome, those who didn't have, who lost like those 5%, some even start menstruating.
Yes, naturally.
Naturally. If they look a bit on their diet, it works.
Yes.
And things
exercise.
And exercise and things move. But again, like I'll say, I might not really exploit this because the treatment is wide and diverse. The best thing is to see your doctor. On this. If you are having irregular periods, if you notice that your body is becoming hairy, if you notice that your body is having acne, pimples on the face and moving from the face, sometimes it can go to all over the body for some people. If you notice that you are losing your hair and you are having irregular periods, something worth also to consider. Yeah, and then you had asked something to do with we've mentioned the weight, we've mentioned smoking, we've mentioned the alcohol. Apart from smoking being an issue in terms of fertility, it's also a risk factor for cancer, including cervical cancer.
Oh, okay.
Yeah,
smoking.
Yes, so, and you will be wondering why people who are not smokers are getting it. It's because we are smoking generally. Outside here, there's a lot of smoke. So there's this cervical cancer, and the way I was rising, I had reached the level of a woman getting into menopause, and then the problems that now come with the menopause itself, and the risk. So once the organs, even here again within the reproductive age, many women suffer from what we call fibroids. Which is a very common condition. They suffer from fibroids especially. We say in a social way that fibroids like an empty uterus. We are not saying that every woman should become pregnant. But the longer the duration that you are not conceiving, your interdelivery interval, you are taking years, 10 also. Definitely you'll have a fibroid, but fibroids are also a factor of race. Fibroids are common in black women, and all of you are a black woman. I don't know whether I'm addressing some white women.
I told you, it's very sincere.
So every woman has got some fibroid of some sort, or might not have, but majority of black women have. Some like a pimple, others like a whole pole, others like the whole abdomen. And it is just because of, there's a genetic component. Once we talk about race, then it means there's genetics in it. And also there's hormones, the things I talked about earlier on. But fibroids, because every woman has, it's not every fibroid which is operated. We only operate those fibroids which have got symptoms. And the symptoms could be, they have reached a level where they are causing excessive bleeding during periods. Or the fibroids have reached a level where there's a lot of pelvic pressure here. You are getting constipated, you urinating frequently because they have put pressure on the bladder.
Yes.
And there's a lot of pain. Some fibroids die and they cause a lot of severe pain. Others become like a stone. Others become like fluid inside there. Others become like some gel in it. We call them, degeneration of some sort. So we only treat those fibroids which have got serious effects on you, especially those ones which now cause infertility. You are unable to conceive because of them.
Yes.
You are bleeding until you are admitted, or your blood level is below 10, and just because of periods, then it's just an indicator that there's something that needs to be done.
Yes.
So your doctor will always guide you on which kind of fibroids need attention.
Yeah.
Because every woman, if we did every woman an ultrasound, we might find like a small fibroid just hanging in there, but it does not necessarily require that much attention.
Okay.
Yeah. So again, those fibroids, they have only, most of the times they are not cancerous. 1%, 1 out of 100, it might lead into some very fast growing tumor we call sarcomas, which can grow and fill your abdomen in weeks.
So